Throughout this period, Kit needed good attention to symptoms and her emotional health. But at a certain point in that illness, it was time to focus solely on quality of life issues. When you think about Kit as an example, we can't talk about only Kit's illness. She's part of a family system, and that whole family is affected by the illness, and even when Kit dies, that family will go on, but it won't go on in the same way, and they need continued support. Kit, like everyone, needs more out of healthcare than just focusing on the disease. It's focusing on the whole person. When surveys have been done asking Americans what they want if they have a serious illness, serious enough from which they could die, the vast majority say they want information. They want to know the truth because it helps them plan for the future. More than 90% say they want to die at home. And more than 90% would say it's a family responsibility to take care of somebody in those last months. So most families cannot do this alone. Hospice care was developed to help families care for those they love with information and skill and professional help. And that's what I want you to know about, what is available to you and people you know who may need this. When you think about the development of hospice care, it actually has a long history. It started as simply places for people who were on a journey who needed to rest on the journey. It's the same origin as hotels and hospitals, because many people who needed to rest were sick. It was in the 1800s that specialized places to care for the sick were first developed, first in France and then in England. If you think about care first directed at the disease and controlling the disease, and then, for example, in Kit's place, where then the focus became on her comfort, that is end-of-life care. That is that period when there are efforts to control the disease, whether it's cancer or other diseases, is the total focus of care. And that care needs to go on even after the person dies to support the family in a period of bereavement. Now, the term hospice in the United States has 4 distinct meanings. I hope you have the sense that the most important meaning is that it's a philosophy of care. It's about taking care of the whole person, mind, body, and spirit. The commonest myth about hospice care is that it's a place to go to die. Yet I said most people want to be at home, and so it's an approach to being cared for at home, and it is paid for by most insurance programs in the U.S., including Medicare, which pays for the majority of care of elders. The term also refers to the organizations. The good news is there are more than 3,000 hospice programs across the country that cover most parts, so wherever you live, there is likely to be a hospice program that serves your area. One of the questions I'm often asked is, how is a person eligible to get hospice care? And there are only 2 criteria. The first is that a doctor certifies that a patient has a prognosis of less than 6 months if the disease follows its usual course. One of the biggest myths about that is the doctor has to be sure that someone will die within 6 months. All that's asked is that more likely than not, the person is in the last 6 months. Another question that comes up is, well, what happens if the doctor is wrong? Hospice care can continue for as long as the patient has the serious illness. The longest I've ever had a patient of mine cared for in hospice care was 5 years, where the focus was only on her comfort. Now you might wonder, gee, did all of that care to help her feel more comfortable, help her live longer? I'm inclined to think it did. So the first criteria is having a prognosis of less than 6 months. The second is that the goal of care is primarily focused on comfort. Comfort for the patient and the family as part of a unit, as opposed to trying to cure the underlying disease. Now, the next question I'm often asked is, well, what benefits? What do you get when someone is enrolled in hospice care? You get a team of people working for you and your family. It involves doctors, nurses, social workers, spiritual counselors, volunteers, therapists. All of the medications that you would need are covered under the hospice insurance. All of the equipment that you might need, beds, chairs, over-the-bed tables, wheelchairs, oxygen, all of that is provided, and all the supplies that you would need. When you ask families what was the most important thing for them when someone they loved was receiving hospice care, they would say it's the practical help. Responding to the challenges of day-to-day living from somebody who knows what to do. They would also say it's knowing that they have advice 24 hours a day, 7 days a week by phone, that someone will come out to the house in the middle of the night or on weekends if there's a problem, and that there is support there for the patient and the family throughout the illness, however it goes. Many patients say, well, I don't think I need hospice care yet. But what most people appreciate is that the care is not just for them, but it's for family as well. You could probably imagine someone who is independent and strong and self-reliant, but it's the family that needs help. Coping with the illness, young children who need to help understanding, helping with the rest of the family's ability to cope, including even after the patient has died. Bereavement support in all hospice programs continues for at least a year, and that is very comforting if you are concerned about your family to know that someone else is looking in on them when you're not there. Now, what about inpatient care? I said that one of the great myths about hospice care is that it's a place to go to die. And yet, a few patients, out of nearly 1 patient in 4 in the United States, receives hospice care at the end of life. The vast majority are cared for in their own homes, or if they live in a nursing home, they get care there. But a few patients may have symptoms that are so severe or family problems that are serious enough to need to go to a dedicated inpatient hospice unit. I work in a unit like that. You might imagine that some pain problems can't be controlled at home and need medicines that are only available in a dedicated inpatient unit. But those kinds of